My name is Taylor Chambers. I use the she, her series of pronouns, and I work for the Oregon Health Authority at the state level. My work is primarily focused on youth suicide prevention, but we at the state level focus on suicide prevention across the lifespan. So youth, adults, and everybody in between and outside of that too. We want a mentally well community and population and people that are overall healthy. And so in order to do that, we care about suicide across the lifespan. I think for a lot of people, when they think about what co-occurring disorders and preventing any sort of kind of negative consequence or outcome, is thinking back to, well, what could that look like? And so suicide is part of that conversation too. And so remembering that suicide is part of the things that we can look to prevent is an important conversation for us to have. While we have kind of one comprehensive framework that we kind of fill all of the work we do under, we have two statewide suicide prevention plans. One is focused for adults 18 and older, and the other one is focused on youth up through the age of 24. So they both kind of intersect that 18 to 24 age group. And the reason for that is twofold. The youth plan really focuses on the youth and systems from that 18 to 24 range. So youth who are in the workforce would not be in that range, but youth who are maybe going to college next, or who are still in high school but maybe graduating a little bit behind schedule from where they would normally. Youth in foster care, resource parents. The other side of that, the 18 to 24 and the adult plan covers youth that really the 18 to 24 population that really looks to enter that workforce right away and maybe is not intersecting with the same systems we see in some of our younger youth. So the reason we've also kind of added those that population that intersects into those two plans is because we see a high rate of suicide in our 18 to 24 year olds. The 18 to 24 year old is a particularly risky time period for youth and young adults. It is important to us to think back about shared risk and protective factors when we're looking at suicide, because we know that if we can address more upstream approaches to suicide, we can impact outcomes, negative outcomes of suicide and suicidal ideation. If you're wondering as an adult, what could I do to help support my community, be that youth, be that other adults, there is information on suicide prevention trainings that we offer. And if you go to that link, you can get more information on those trainings.